Buddies, I had made this video previously in Hindi. Now I wanted to make this video in English also because that's a common topic which gives you some kind of confusion there about the Courvoisier sign. Some people call it Courvoisier's law. So basically, Courvoisier law itself may not be important, but the exceptions to the Courvoisier law are important and they are often asked in the examination. Before we understand this, let us understand the brief physiology of the bile production and secretion. So you see, buddies, the bile is produced round the clock by the liver. So what will the liver do? Liver will secrete this bile into secrete this bile into left hepatic duct and right hepatic duct. Let me just copy it up because I might use this image later. Just give me a minute. I want to copy it up. Yeah, I want to use this image time and again. Right. So liver will produce bile, right, and it will secrete the bile into right hepatic duct and left hepatic duct. Now both of them fuse with each other to form common hepatic duct. This common hepatic duct will fuse with cystic duct to form common bile duct, which in turn will fuse with main pancreatic duct, and then they open in the second part of duodenum at the ampulla of Vater. Now there is a sphincter, the sphincter of Oddi, which remains closed. Okay. So what happens is these blue colored arrows, they indicate the flow of bile. Because the sphincter of Oddi is closed, bile will now enter the gallbladder. Gallbladder will concentrate the bile by around 5 times. It will make the bile acidic. And apart from that, daily it secretes 20 ml mucus. Fine. This is important thing for you to remember. This is important thing for you to remember. Right. Now listen to me, buddies. Let's say your patient has gallstones. Okay. So as a sequelae to gallstones, your patient will have acute cholecystitis. This eventually will turn out into chronic cholecystitis. Now, what is the chronic cholecystitis? The gallbladder is fibrosed. The gallbladder is shrunken. Fine. That means the gallbladder, it cannot dilate, it cannot, it cannot become big, right? It cannot become big. Okay. Now, let's say, buddies, that one of the gallstone reaches here. Okay. Now, this gallstone will obstruct the flow of bile. So there will be jaundice. The bile will eventually go back into the gallbladder. Unfortunately, this gallbladder cannot expand, right? Because it is fibrosed, it is shrunken. Let us consider another scenario. Then we'll read this, okay? Then we'll read the Courvoisier law. Something already written here for your convenience. Now let's say, buddies, we read about another scenario. Let's say there is a malignancy here. There is a malignancy around the ampulla of Vater. This malignancy could be carcinoma pancreas, of the head of pancreas, or this could be cholangiocarcinoma. Okay. Now this cancer is blocking the flow of bile. So there will be jaundice. First thing first, your patient has a cancer, a malignancy. Second, your patient has a jaundice, right? Because the bile is not flowing properly. Okay. Then, where will the bile go? Bile will enter the gallbladder. Bile will enter the gallbladder, and this gallbladder will become massively big. This gallbladder will become so big that it will be palpable by the surgeon. It will be palpable by the examiner. Right? Now let us see what does the Courvoisier Terrier sign has to say, given by Swiss surgeon Ludwig George Courvoisier Sahab. So it says that if there is a patient who has got painless jaundice and an enlarged gallbladder, big gallbladder, dilated gallbladder, the cause will not be gallstones. Remember, in gallstones, we will have fibrosed gallbladder which cannot expand, which cannot become palpable. So therefore, the cause should be an obstructive pancreatic or biliary cancer. Fine. So Courvoisier law says if your patient has obstructive jaundice, that is painless jaundice, and your patient has palpable gallbladder, the cause will not be stones at all. The cause will be a cancer, presumably the cancer of pancreas. The cancer of pancreas. So, again, that's the Love and Bailey saying that if there is a palpable, non tender gallbladder plus jaundice, fine. So, the diagnosis is due to common duct obstruction caused by periampullary malignancy and not by stone, right? Now, the important thing which is often asked in the question, what are the exceptions? What are the exception to the Courvoisier's law? Courvoisier's law. Find Courvoisier's law. Sometimes I make a mistake. Courvoisier's law. Right? Now, see, buddy. Let's say your patient has gallstones. Okay. Now, there is a big gallstone here. Right? Then there is another gallstone here at the neck of gallbladder. Let's call this S1. Let's call this S2. Right, buddies? So this S2 stone, this will block the flow of bile and your patient will develop jaundice. Okay. Now, the second stone, which is at the gallbladder neck, what it will do? What is it will block the flow of bile. Now the bile cannot enter gallbladder. Now the bile cannot enter gallbladder. Okay. Then even then this gallbladder will become big. Why? Remember, daily the gallbladder secretes 20 ml of mucus. 20 ml of mucus it secretes per day. It secretes per day. So this gallbladder will become big. This gallbladder will be palpable. So now we have palpable gallbladder and jaundice also. And what is the cause of this? Stones, gallstones. Exactly opposite to what Mr. Courvoisier had said. So that is called as double impaction of stones. That is the only meaningful exception to the Courvoisier law. Courvoisier law. Then we have got vague exceptions. For example, let's say your patient has empyema gallbladder, the gallbladder which is full of pus, that will also expand and it will be palpable, and your patient may have jaundice. The third vague exception is that sometimes the cancer may not cause complete obstruction. So in that case, jaundice will also not be there, right? Jaundice will also not be there, and palpable gallbladder will also not be there, right? See here, but that's what I'm trying to say. Now, let's say there is a cancer. This cancer is not completely blocking the flow of bile. Bile will continue to flow freely into the duodenum. There will be no obstruction, so no jaundice will be there, right? No obstruction, so no jaundice will be there. The fourth vague exception to the Courvoisier law. Let's say, buddies, there is a Klatskin tumor here. Now this Klatskin tumor, it will block the flow of bile here only. So your patient will develop jaundice, but gallbladder will not be palpable. Gallbladder will not be palpable because the bile will not enter the gallbladder at all. So that's a fourth exception to the Courvoisier law. Fourth exception to the Courvoisier law, that is Klatskin tumor at the junction of ducts. Fine. So the only main exception to the Courvoisier law remains to be double impaction of stones. Right. That was Courvoisier's law. Fine. Once again, if you could not understand it, please do send your queries in the comment section. Right. I'll be back with you guys with a small video, another small video. Right. All the best.